every time we've no control.
China has identified the cause of the
mysterious new virus.
Coronavirus.
coronavirus.
So let's talk about introduction. After COVID-19 hit Malaysia in 2020, the Ministry of Health, or we know as MOH, faced many challenges even after case dropped in 2020. Hospitals were overwhelmed, staff were burned out, and many patients still suffer from long COVID-19. Mental health issues also rose, especially among young, but support was limited. Fake news caused fear and vaccine hesitancy. This problem show weakness in the system. Today, MOH, healthcare workers, and the public are still dealing with the impact.
SWOT analysis MOH COVID-19 response. For this range is early proactive response, effective use of MySejahtera app, flexible decision making, for example, SOP updates and quarantine change. The next one is the weaknesses, which is healthcare worker burnout and shortage, a digital infrastructure initially underdeveloped, and the last one is public mistrust due to SOPs, confusion and misinformation. The next one is opportunities. Opportunities, they do expand and upgrade MySejahtera app system. They do reform and strengthen healthcare system. They also do promote a long-term hygiene and mental health education. The next one is for the threats. For the threats is people might become less careful over time. They do not enough funding, could slow down improvement. They also do relying too much on other countries for vaccine and tools which can be risky. Managing the issue, 2.0 planning. So what is a planning? Planning is a systematic process to set goals, analyze conditions, forecast needs, organize resources, and identify risks. It helps in decision making and ensures smooth execution of action to achieve objectives. How MOH manage post-COVID-19? In the early response phase, they do implemented strict border control and quarantine. They also conducted contact tracing for positive cases. The next one is they do introduce a MySejahtera app for health status update. And the last one is a first movement control order, which is MCO to limit virus spread. The next one is in the vaccination phase. They do launch a national COVID-19 immunization program. They do prioritize frontline workers and high-risk group, for example, doctor. The next one is they set up a mega vaccination centers. And the last one is they do use a MySejahtera apps for vaccine registration and certification. Last but not least is pandemic management phase, which is till now they do shifted to treating COVID-19 as manageable. They do relax SOPs, which means we do shorter isolation, and we use a mask in a specific areas only, for example at hospital. The last one is they do continue monitoring for new variant. What is a short-term goal for this issue? So for the short-term goal is the MOH support post-COVID-19 recovery by treating long COVID-19 patients at public clinics. For example, by using MySejahtera for health updates. They do a revision SOPs and running awareness campaign on hygiene on post-COVID-19 care. Long-term goal. Long-term goal, MOH. So MOH aims to strengthen the health system and prepare for future health threats by making COVID-19 care part of regular health care. They also continue to improve the MySejahtera app, expand hospital capacity, train more medical staff, and support research on long COVID and vaccine effectiveness to guide future policies. Objective to manage post-COVID-19. Actually, we do have three, which is short-term, medium-term, and a long-term. So for the short-term is, we do provide a rehabilitation for a long COVID patient. We do refine SOPs, for example, the isolation and a mask rules. The last one is we do administer booster vaccine to high-risk group. Next, for a medium term, We do integrate COVID-19 care into a routine health services. We do expand MySejahtera and digital health system. We also increase healthcare capacity and continue research on the vaccine impact. The last one is long term. For a long term, we do improve our readiness for future pandemic. We also do promote a public health education and healthy lifestyle. And we do strengthen a long-term health security for the nation.
3.0 Managing the issue. Organizing. Key organizational strategies. Work specialization. Form task forces for mental health areas treatment and digital upgrades. Second, departmentalization. Strengthened public health department for intelligence and outreach. Expanded health informatics department for digital records. Clear communication and resource allocation. Third, line and staff authority. Line authority ensure consistent command across federal to district levels. Staff rules, support with expert input, enable data-driven and decision-making.
What is decision-making? Decision-making is the process of identifying and choosing the best course of action to solve problem. It is essential for all levels in management and supports POFC, which is planning, organizing, leading and controlling. It helps to improve effectiveness and productivity. MOH has used two types of decision in manage the post-pandemic COVID-19, which is program and non-program. For the program, they are doing the routine decision, which is SOP and must use in a hospital. For non-program, it is complex and new situation. For example, they are reducing isolation days from 7 to 5 days and removing HSO. And for key decisions that are made by MOH, which is continued use of MySejahtera app for monitoring. And for the second isolation period, reduced from 7 to 5 days based on current research for cases. For the approach, they use both decision types to balance and flexibility, enable smooth transition from emergency phase to managing post-COVID-19 as part of daily life.
5. Controlling. Initial control measure by the MOH. Yearly lockdowns with the movement restriction, targeted screening and institutional quarantines. Equal care of citizens and non-citizens, reduce transfer rate and ease healthcare burden. Use of the MySejahtera, jointly departed by the MOH, NAS, Mampu, MCMC and MOSTI. The functional is the health monitoring and treatment units located nearby the hospital and clinics and is available on all smartphone platforms. Doesn't matter which platform, Huawei, App Store or Apple Store. Automated COVID-19 monitoring system developed by the 6th April 2024 is track community transmission city responded capacity RC, situational level SL and daily updates using MOH, GitHub and National Stat. And lastly, post-pandemic updates as for July 15, 2024, COVID-19 test result no longer upload via MySejahtera as result reported by the medical via practitioner via e-notification and acid test now used only for the treatments, no screening.
Recommendations and suggestions. First, enhance public health education. Run ongoing campaigns about hygiene, vaccination and long COVID-19 awareness. Use schools, social media for better outreach. Second, invest in healthcare infrastructure. Increase ICU beds, isolation facilities, modernize hospitals with better tech, digital records and clean facilities. Third, prepare for the future. Continue research on COVID-19 variants and vaccine effectiveness. Strengthen international cooperation for quicker access to vaccines and treatments.
Conclusion, Malaysia respond early and follow WHO guideline. Lockdown, screening and vaccination help control the spread. Public cooperation and government support, unity, responsibility and patience are vital to overcome future challenges.